Today is Tuesday, December 20th, 2016. This is a case study of an actual cat, male, neutered, 13 years old, domestic short hair cat, which came in on October 1st, 2016, which is about nearly 2.5 months ago. We're having seizures 6 times. So, because of that, they quickly bring the dog to Toa Payoh vets. And so, inquiry on the signs were very hungry, very thirsty, pass a lot of urine, and weight loss. The owner is not very sure, but the cat was weighing 4.8 kg. So, we do a blood test, as seizures could be due to hypoglycemia, and so this is the blood test results. Now the significant results will be high cholesterol, high triglycerides. So this is one test results abnormal. Then further down, the important one is this one, the glucose. Now glucose was found to be 26.9 millimole per liter, whereas a normal is 3.9 to 6. So if we translate to the equivalent of 485 milligram per dl, whereas any diabetes will be over 200 milligram per dl. So this cat has hyperglycemia on arrival, and the blood test shows that the liver, definitely liver disorder, probably the fatty liver, and there is also a higher calcium, blood calcium, and the kidney disease is there. You can see the urea is high, and the creatinine level is high, so there is kidney disease. The kidney disease, creatinine level is high. Then the hematology normally is normal, but in this case the platelet is a bit low. So there was no serial blood glucose curve done for reasons of cost. Now the cat was recommended to be given Vaseline 0.03 units 2 times per day. Then so this is Vaseline, and the owner did give, and they are supposed to observe the clinical signs like appetite, hunger, thirst, and urination to assess whether it's effective or not. Giving Vaseline twice a day at 0.02 ml. So the owner did her own injection under the skin, in between the spinous, from the shoulder to the hip area, and also the diet. So feed the cat exclusively on WD plus the canned food twice a day. So much depends on the owner's need to be serious, because many owners are very busy working. So they, if they don't control it well, then there will be another repeat episode of hyperglycemia. So I spoke to the owner, and today apparently she had increased the dose to 0.05 2 times a day. There were no seizures, but the cat, according to her, was more active, argue back or playful, but still eats a lot, drinks a lot, although there was less than before the treatment. So I advised her to be serious and to do the home monitoring recording. Now it's not practical to do the urine test for urine glucose, or ketones or SG, but at least she can monitor the food intake, the water consumption or water drunk, and of course urination, going to the PP pen, and of course weighing the cat every week. Now if she does a good job of monitoring, there will come a time when she will find that 0.05 or 2 times a day might not be sufficient. So let's say after 2 weeks, then she increased a bit, 10%, and so on and so forth, until one day she finds that the cat is eating normally and drinking normally. That's when the clinical sign shows that the diabetes is controlled. So the food will have to be high fiber ones and no more treats or other drugs or stress onto this cat. This is a 13-year-old cat, and it's got diabetes on it at this age, usually male neuter cats. Now, according to some literature, sometimes after a period of treatment, there is no need to give any more injections for cats because they get remission. So let's see how this cat fares in the months to come. So for the meantime, owner has to keep proper records, but she's very busy working, so she didn't really keep a proper record of the intake of food, water consumption, and of course the peeing, and also the weight gain or weight loss. So if she does this properly, she will know exactly whether the injection of Vaseline is effective or not. The ideal amount here, which she give twice a day, and it's already 2.5 months, so we will have to continue educating the owner, as they may not be aware of the need to do careful home monitoring of the cat with diabetes mellitus. December 20th, 2016, Toa Payoh Vets, a case study of a male neuter cat, 13 years old, with diabetes, presenting signs of seizures 6 times before coming to Toa Payoh Vets in October 2, 2016. Now it's December 20th, 2016.